Welcome everybody with you Dr. Magdy Abdurazik, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about do you have syphilis? Syphilis is a sexual transmitted infection. If it is not treated, it can cause serious and potentially life-threatening problems. So, the symptoms of syphilis are often mild and hard to notice. They tend to change over time and may come and go. Sometimes small sores or ulcer on your penis or one ulcer, sometimes on vagina or around your bottom, around the anus. There are usually painless and you may only have one of them. Sores in other areas, including your mouth or your lips, hands, or around genital organs. White or gray warty growth, most commonly on your genital organs, whether penis, vagina, or around your anus. A rash on the palms of your hands and the soles of your feet that can sometimes spread all over your body. This is not usually itchy. White patches in your mouth, flu-like symptoms such as high temperature, headache, and tiredness. Sometimes swollen glands, patchy hair loss on the head, beard, and eyebrows. It can take 3 weeks or more for the symptoms of syphilis to appear after you are infected. Sometimes the symptoms can improve or go away completely, but if you have not been treated, the infection is still in your body. This means you can still pass it and you are at risk of getting serious problems later on. So, we have to advise you to go to a sexual health clinic. Uh, so, a sexual partner has told you they have syphilis or another sexually transmitted infection, or you have recently had sex with a new partner and did not use a condom, or you are pregnant or planning to get pregnant and think you might have syphilis, or you have injected drugs using a needle that's been used by someone who might have syphilis, or having a test is the only way to confirm if you have syphilis. If you do, treatment will need to be started as soon as possible. Tests for sexual transmitted infection are free in the governmental hospitals. So, other ways to get syphilis test, you can also have syphilis test during pregnancy, antenatal appointment if you are pregnant, or using a self-test kit. You may be able to order a kit online to test yourself. So, what happens during syphilis test? If you have symptoms of syphilis, a doctor will check your penis, vagina, around the anus for syphilis sores or ulcers. They may use a swab like a cotton bud to collect fluid sample from any source. So they also check the rest of your body for other signs of syphilis like a rash, sores, or wart-like growth. They may also take a blood sample. You may also have tests for other sexual transmitted infection. So, as regards the treatment of syphilis, syphilis is treated with antibiotics, which you may have as injection or tablets. Treatment may be started before your test result is known, but it is better to delay the treatment until to be sure that you have a syphilis. How long you need treatment for will depend on the stage of your syphilis. Treatment can cause flu-like symptoms such as high temperature, headache, and aching muscles. This usually lasts for up 24 hours. You will need to go back to the doctor to take advice from him. Don't have sex, whether vaginal, anal, or oral, until you and your partner have finished treatment and tests have shown treatment has worked. So, what about complication of syphilis? If it is not treated, syphilis can cause serious and potentially life-threatening problems, including heart problems like angina, aortic aneurysms, and heart failure. Sometimes brain problems like fit seizures, memory problems, personality changes, dementia. All this may occur due to neurological syphilis. Sometimes also nerve problems like shooting pains, pins and needles. Sometimes joint pain and gradual damage to the joints with the skin and bones. Sometimes testicles, liver, and other organs can be affected. Some of these problems may not appear for many years after being infected with syphilis. Syphilis during pregnancy. If you are pregnant and have syphilis, you can pass it on to your baby before they are born. This is known congenital syphilis. So, this may lead to the risk of miscarriage, premature birth, and stillbirth. You will be offered screening for syphilis if you are pregnant. This is called prenatal care. So it can be found and treated before it can cause any serious problems. The most common way of getting syphilis is by having unprotected sex, vaginal, anal, or oral, without condom, with someone who is infected. You can get the infection if you come in contact with an ulcer on their penis, vagina, or around the anus, or inside their mouth. It is also possible for syphilis to be passed on to unborn baby during pregnancy. This is called congenital syphilis, by injecting also drugs with a needle that has been used by an infected person during blood or organ transplant. So this is very rare, as all blood and organ donations in the around the world are checked for syphilis. Thank you very much.